Clinical management is a domain that's most heavily weighted for the SCA exam. This is a domain that many trainees struggle with. One particular aspect of clinical management is shared decision making. In this video, we're going to look at how to develop shared decision making and implement it in your consultation. If you're new here, hi, my name is Dr. Erwin Kwun. I'm on a mission to help doctors lead a fulfilling life. I help GP trainees pass their SCA exam. Let's get right into the video. A common misconception that trainees have is thinking that shared management is all about sharing options, and they think that when they're sharing a bunch of options to a patient, that's what they're doing right to share the management. But that's not right. Shared management is about how you share the decision making with your patient so that the patient can make an informed decision in collaboration with the doctor. To effectively implement shared decision making, the free talk models might be helpful. So step number one is exchange of information. This is where you discuss what are the risks of a treatment and the benefits. So you're exchanging information with the patient. Step number two is deliberation. This is where you deliberate over options, if there's options, and take into account the patient's interests and preferences. And step three is decision. So this is where you and the patient make a joint decision that is aligned to the patient's interests and what goal that you're trying to achieve. By following these free talk models, then you have a more stepwise approach to shared decision making. Let me give you an example. You've got a patient who has got an elevated HbA1c level. So this is a new diagnosis of diabetes, and the patient would like to know the results. So you discuss the results with the patient. When it comes to the decision making, whether you're going to start the patient on a medication or not, instead of just starting the patient on metformin, for example, it's important that you exchange information with the patient, explain about the things that the patients can do in terms of lifestyle changes to improve the sugar level. Then you can also discuss about the possibility of a medication as well and explain the benefits and the risk of the medication. Have you found the insights in this video useful so far? If so, you might be interested in SCA Blueprint and mini course. This is a free blueprint that you can get and teaching from myself. Just click the link down in the description below and sign up, and you will get a teaching from me every day for the next 7 days. Then the patient and you can deliberate over whether to start medication or try lifestyle modification for the next 6 months. The decision making needs to be a joint decision making where you and the patient agree what's the next course of action. It's really important that you don't make the decision for the patient, as in starting them on the medication and just say to the patient, you need to start taking metformin, that'll be all right with you, because that's too doctor-centered. Because what you want to do is float the idea of the medication, explain to the patient the pros and cons, and also tell the patient your professional opinion, as in what's best for them, and then let the patient decide and then make the decision together. So this is how you achieve shared decision making, where you're deciding with the patient in collaboration as opposed to making the decision for the patient. If you want to learn more about shared decision making, you might want to check out this video in which I go much more detail how to develop shared decision making. Click here to watch it. Take care, everybody. Bye-bye.